Every type of cancer. Breast cancer begins in the milk ducts and is far more common in women. Cells multiply quietly, often without symptoms. Genetics, hormones, and age raise risk, but earlier screening now catches it sooner, improving recovery odds. Lung cancer starts in the airway lining and is mainly caused by smoking, though pollution and genetics can trigger it too. It hides for years, making it one of the deadliest cancers, with symptoms like coughing appearing late. Prostate cancer develops in the prostate gland and usually grows slowly, often without men ever noticing. Age past 50 is the main risk. Doctors often monitor rather than treat immediately, and early cases have a strong outlook. Colorectal cancer forms in the colon or rectum, usually starting as small polyps that can turn cancerous over time. Diet, age, and family history raise risk. Routine colonoscopies catch and remove polyps before they become dangerous. Melanoma begins in pigment cells of the skin and spreads aggressively if untreated. Sun exposure and tanning beds are the main causes, especially for fair skin. A changing mole is usually the first warning sign. Bladder cancer starts in the bladder lining and is more common in older men. Smoking is a major risk factor since harmful chemicals irritate the lining over time. Blood in the urine is usually the first symptom. Non-Hodgkin lymphoma develops in the lymphatic system when white blood cells grow abnormally. There are dozens of subtypes, some slow and some aggressive. Swollen lymph nodes, fatigue, and weight loss are common but easily missed signs. Kidney cancer begins in the tiny filtering tubes inside the kidney and often grows silently. Smoking, obesity, and high blood pressure raise risk. Many cases are found by accident during scans done for other reasons. Endometrial cancer forms in the uterine lining and is the most common reproductive cancer in women, often linked to hormone imbalance. Abnormal bleeding after menopause is usually the first sign, which helps catch it early. Leukemia, a cancer of the blood and bone marrow where abnormal white cells crowd out healthy ones. It forms no lump, so it's harder to detect. Fatigue, frequent infections, and easy bruising are common warning signs. Pancreatic cancer starts deep in the pancreas, making it notoriously hard to catch early. Weight loss, abdominal pain, and jaundice tend to appear only once it has advanced, which is why it's so difficult to treat. Liver cancer usually follows years of damage from chronic hepatitis or heavy alcohol use. Repeated injury can cause cirrhosis, sharply raising cancer risk. Because the liver handles so many functions, symptoms often stay hidden until late. Thyroid cancer forms in the gland at the base of the neck that regulates metabolism. It's usually slow-growing and highly treatable. A lump or swelling in the neck is typically the first thing people notice. Ovarian cancer begins in the ovaries and is sometimes called a silent disease, since early symptoms like bloating are vague. It's often diagnosed after spreading. Genetic mutations, including BRCA, can significantly raise the risk. Cervical cancer develops in the cervix, mainly caused by long-term HPV infection. Regular Pap testing has cut cervical cancer rates dramatically by catching abnormal cells early. HPV vaccination has lowered risk further for younger generations. Testicular cancer forms in the testicles and is rare overall, but it's the most common cancer in young men. A painless lump is usually the earliest sign, and it has one of the highest cure rates of any cancer. Brain cancer can start in brain tissue or spread there from elsewhere. Symptoms vary by location, from headaches to changes in vision, speech, or coordination. Treatment is often complicated by the brain's delicate structure. Stomach cancer typically starts in the stomach lining, often linked to H. pylori bacteria and salted or smoked foods. Early symptoms like indigestion are easy to dismiss, which often delays diagnosis of the disease. Oral and throat cancer develops in the mouth, tongue, or throat, often linked to tobacco, alcohol, and increasingly HPV. A persistent sore, trouble swallowing, or a neck lump are common warning signs worth checking. Esophageal cancer forms in the tube carrying food to the stomach, often linked to chronic acid reflux and a condition called Barrett's esophagus. Difficulty swallowing is usually the symptom that finally brings people to a doctor. Subscribe.